Okay, we still have a few folks joining us, but I believe we're going to start recording. And I wanted to welcome everyone who's here to our monthly data quality monitoring webinar. This is June of 2024, and we're going to be covering county behavioral health plans, mainly the 274 data for mental health plans and the drug Medi-Cal organizational delivery systems, so DMC-ODS. All right, next slide, please.
Hello?
Hello, please mute if you are not muted. Okay, my name is Amy Peterson, and I am the Managed Care Data Support Section Chief. I'd like to go next to the next slide, please. Again, we're going to be covering the 274 expansion to behavioral health managed care delivery systems. This is the mental health plans, and 274 expansion to behavioral health managed care delivery system. So the drug Medi-Cal organized delivery system and the county mental health plans and the 274 data submission requirements, and also some general information. And as we always do, we'll be going over communication information and other resources at your disposal. And May just posted that you can go ahead and ask questions in our chat. We'll take your questions. Speakers today will be myself, Amira Kidane, Sherry Garcia, and Jeff Jennings. Supporting this particular project, as always, we have Abby Gebrselassie, May Sean Ang, Samantha Van, and we also have some folks who are not here today with us, but help support this: Xiaoyan Ma, Ane Guerrero, and Sujung Kim. Thank you so much, everyone who supports this, and thank you for everyone who's speaking today. Next, for general questions, again, please go ahead and submit your questions to this WebEx chat. We'll collect them. And please ensure that your questions are visible to all participants, because the person running the show and sharing his screen right now, that's Abby. He's hosting. He's not even checking his private chat right now. So make sure that your questions are visible to all participants. And for specific questions, you can go ahead and reach out to the appropriate data mailbox that will be available at the end of this slideshow. We'll have a list of different ones for very specific questions and needs. And if you are at a loss ever, you can always contact our webinar team at mcdss@dhcs.ca.gov. We'll be posting pretty routinely in the chat information and links, but all of the links that are in this slideshow will be live when it is posted and published. And if you didn't see it, the May webinar has been posted, and so all of the slides, the transcripts, and the actual slideshow and presentation are posted on our webinar page. Next up, I'd like to introduce you to my friend and colleague, Amira Kidane, and she will be speaking about the 274 expansion to county behavioral health managed care delivery systems, aka MHP. Thank you, Amira. Welcome. I think she is still muted. Can we unmute her, please?
Appear on the May.
And so they all approved?
Oh, yeah, they're all approved.
Can we? Hello, can we please unmute Amira and mute everyone else?
Thank you. Good morning, everyone. My name is Amira Kidane. I am the Health Program Specialist 2 for the Network Adequacy Oversight Section, and I'm the lead SME for the Mental Health Plan transition into 274. Next slide. So we just wanted to give a brief update here. All of the 56 MHPs are approved to submit monthly 274 provider network data file to DHCS, and they are all in production and have been submitting month over month files. Any MHP that does not submit the 274 file within the submission deadline is subject to a cap in accordance with the MHP 274 BHIN 2232. And the reason for that is on the next slide. So counties have been waiting for this for a couple of years. So the DHCS is discontinuing the network adequacy certification tool as of July 2024. So starting in July 2024, all MHPs would need to report their monthly reporting period to validate for compliance for the following standards for annual network certification. So for this upcoming fiscal year 24-25, counties are no longer required to submit the NAT. Instead, we are selecting July 2024 as the file month for members to submit their provider network data. And as you know, the 274 file, we will use that for compliance for our annual network certification for provider to member ratios. That's the capacity and composition, also known as TE. The time or distance standards analysis will come from that. We will be pulling data from that. And then of course the mandatory provider types. Next slide. So I just want to say, just real quick here, that we will be sending a detailed, sometime this week, the network adequacy team will be sending a detailed email regarding the selection of July 2024 and the termination of the NAT. So most of you have been corresponding, most of the counties back and forth based on the monthly data checks. So DHCS has been actively conducting monthly data quality reviews on the MHP 274 data, and that started with the file, the 274 file from December. And I believe the May file was sent out at sometime, I want to say last week. So MHPs are required to correct any 274 data, and that is an error, and resubmit the impacted files within the time frame specified by DHCS. DHCS will use the 274 data for the upcoming MHP 24-25 annual network certification. So what that means is your July file, right, the reporting period July 1 through the 31st is the file we will use to certify your network. So what that means is making sure those corrections, the back and forth, when the 274 team identifies areas that need to be corrected, if we want to make sure the data is representative of your entire network. And that will, and for those that are not submitting, I believe there's one county that's not submitting, you will be out of compliance in those 3 areas, right? The capacity and composition, time or distance, and mandatory provider types. Next slide. And now I'm going to hand it off to Sherry Garcia. I know she was having issues logging on.
I'm here. Can you all hear me?
Yes,
Yes,
we
we
can.
can.
And please try
Yes,
to
we can.
mute yourself if
Everybody
you
else.
have a mic on that's not listed as muted. Appreciate it. Thank you so much.
Hi, everybody. My name is Sherry Garcia, and I am the Health Program Specialist too within the Network Adequacy Oversight section. And Amira's counterpart, and I am the SME and lead for the DMC-ODS transition into the 274. Next slide, please. So as of June of 2024, we have all 32 DMC-ODS plans who have completed phase 1 of the 274 testing. 84 plans, so 27, or 84%, 27 plans have completed phase 2 testing, and we have 24 plans in production. So for the remaining plans that are submitting their test 2 files, we will be reviewing those files and creating observation reports that will assist the DMC-ODS plans in correcting any identified errors as they move into production. Next slide, please. So as the plans move into production, we are going to begin conducting monthly quality reviews on the 274 data. We hope to start these quality reviews in the fall of 2024. The DMC-ODS plans will be required to correct any 274 data that's in error and submit the impacted files within the timeframes that we specify. And we aim to use the 274 data for the DMC-ODS plans by fiscal year 2025-26 for our annual network certification. So we would like to discontinue use of the network adequacy certification tool and move to the 274 data next certification year, as we've done with the MHPs. So it is, So it is imperative that all DMC-ODS plans are in production and submitting quality data so that we can discontinue the use of the NACT tool and move to the 274 data for annual network certification. And with that, I will pass it over to Jeff.
Thanks, Sherry. Appreciate it. This section, the next few slides, are really just basic high-level information about submitting the file and some of the responses, errors, common errors, and things like that. So why don't we go to the next slide, and I'll share a few comments. So the DHCS requires that the 274 network data file be submitted to DHCS between the 1st and the 10th of each month. If you're having any issues, contact the liaisons that have been shared or send an email to the 274 expansion mailbox, and we'll assist you as much as we can with any submission problems. Also, once your submission has been processed, there will be a validation response file, a VRF, that is posted to the response subfolder that's in the directory for your county. Looking at that file will give you the results of processing and essentially share any warnings or errors, areas that might need correction. Finally, in terms of the monthly reconciliation file, please continue to submit the Excel-based PDSRF by the 15th of the month. And this allows us to reconcile what's been submitted and for us to look at counts, compare them to what you have, make sure everything is matching up. Next slide, please. So one of the reasons that files are rejected and have other issues, these are kind of the top 3 issues that we run into. File naming can be an issue. If PACE's system doesn't understand the file name, it can't really process the file, so it will issue a rejection. Please refer to section 3.5 in the 274 Behavioral Health Companion Guide, and that outlines how to create a compliant file name and how to use each node in the file name correctly. Another issue that comes up are the invalid interchange receiver ID and sender ID codes. We state the values in the companion guide in section 3.8. Please consult those. And again, if you have any questions about those, send an email to the 274 expansion mailbox, and we'll work with you on that. And then finally, what is very important, especially with these X12 HIPAA, well, this isn't HIPAA mandated, but X12 designed EDI files, is they must be in an EDI format. That's actually a text, a delimited text file. but the file name must end in the .dat extension for the file to be recognized. Anything else won't be processed. Next slide, please. And these are some of the quality issues that are noted by the quality analysis teams that look at the data being submitted. So obviously a first one is a late submission. Again, if there are issues, please contact the 274 expansion mailbox, outline what the condition is. We can always work with you if possible. Provider full-time equivalent percentage is greater than 100%. That is essentially the providers working more than the usual 40 hours a week. I'm sure many providers do, but please keep it to 100%. Large number of licensor types reported as other qualified provider. This should only be reported if an existing licensure type is not applicable to that provider. Incorrect reporting of site facility types. Reporting an inpatient facility as an outpatient or vice versa. Just make sure you're denoting the site facility type correctly. Another issue, missing bed counts for inpatient facilities, missing site and provider foreign language codes. I believe the codes are provided in the companion guide, but if you have any questions, as always, contact the mailbox. Discrepancies between the NACT data submission and the 274 data submissions is another thing that pops up. And again, we'll work with you on that to help you get it correct. Next slide, please. Yes, so I've referred to the companion guide, and for much of our documentation, although I must make a distinction here because we've had a number of areas to share documentation. The DHCS Documentation Center was set up to host documentation, XML files, things like that, primarily used by managed care plans. As our county trading partners are aware, companion guides for submissions to the short Doyle system are posted on the BHIS folders and are not currently posted to the Doc Center. As DHCS continues integration, decisions will be made about where documentation is posted, and anything that changes that has to do with the short Doyle companion guides, if they change location, for example, migrate to the Doc Center, we'll let you know. But for now, for our county trading partners, for the 274 companion guides and other related artifacts, please use the DHCS Documentation Center. If you need access to that, you can send an email to the data exchange mailbox, and we'll cover this in the next slide. As a matter of fact, please go to the next slide. So as I was mentioning, sort of got ahead of things, the short Doyle companion guides are in BHIS, but the 274s are in the documentation center. I know that's a little scattered. We're working to integrate. For now, it just is what it is. And as I mentioned, for any troubleshooting or access requests, you can always send an email to the data exchange at dhcs.ca.gov. You can mention it in the 274 mailbox, but this is the direct mailbox. I think it's preferable to use that for any Doc Center issues. Occasionally there are issues with links or adding accounts, but we always work through those. So if something like that comes up, please use this email address and we'll help to resolve that issue right away. I believe that's it. So I will hand it to the next presenter.
Hi, this is Amy. I was just disconnected. It might have happened to quite a few people. Hopefully folks do reconnect, but we are recording this. So if you do miss anything or you lose sound action or anything, there's a technical issue, we are recording it. And I don't think that the main connection lost service. So we will be able to present this on the web later. So I don't think we missed too much, Jeff. I definitely missed at least 3 slides.
Really?
But I do know that we had a few questions for you. So I wanted to just kind of cut back to it and then make sure we got those before we lose.
Yeah, so let me make sure I
connection.
understand, because I was just, you know, enjoying the sound of my own voice. I
don't think you were. I think we caught it. I'm just not sure.
Yeah, if there are any of the slides or items that I touched on, although I wasn't reading directly verbatim, the slides should be able to do that.
It should be fine. I think I got disconnected and a few other folks lost it, but we're getting some confirmations that it was a-okay for the most of the people. But we are doing this remotely, and unfortunately that we're reliant on different internet services, so mine cut out, and it may have happened to other folks.
Okay, I would like to just say something very quickly related to some of the chat questions. There are known issues with Teams and SharePoint links. Teams and SharePoint are essentially the same thing. I see in chat, May shared a new link, and that goes to a SharePoint site. I've been working on the Microsoft support site and working with Microsoft support to better understand the link issue that sometimes comes up with the documentation center where it won't resolve. And as soon as we have a better solution for you, we'll let you know. But yes, sometimes the links go to Teams, sometimes they go to the SharePoint. It's all the same site, but it's yet another wonderful Microsoft feature. And then finally, if you do not have access granted to the documentation center, none of the links will work for you. They will not resolve in the expected fashion. And if that's the case, as I had mentioned before, send an email to that data exchange mailbox and we'll get you hooked up as quickly as we can. And if all else fails, we'll email you any of the documentation that we can. Okay, thanks, Amy.
You're welcome. There was a question about the PDSRF Excel file. Is it still expected when the JSON SRF file, which contains the 274 details, is submitted? If that is a really specific question, we can get back to J.R. Sarmiento separately. And then we had another question about the submission of the 274 file. Is it specific to behavioral health or to our entire provider network? It is expanding to the entire provider network. I can speak to that. Let's see. Anything else? I think you answered. Confirming that the PDSRF is currently being submitted in the SRF JSON files and not Excel sheets anymore. Is that correct, Jeff?
Say again, I'm sorry.
Jose Lopez is asking if the PDSRF is currently being submitted in the SRF JSON files and not Excel sheets any longer.
Yeah, you know, that's a point of clarification. And we have some of the key staff working on that project that are out today. I know that's been in transition. I'm not entirely sure, but we'll get that answer for you, Jose, and clarify. Sherry or Amira, do you know what's going on with the PDSRF submissions right now for behavioral health? At all? Are they continuing in Excel or are they supposed to go to JSON?
I do not know the answer to that. Yeah, I don't know
we'll get that
the
clarified.
file type. Sorry.
Yeah, and just to key off of that, eventually, depending on the answer, but eventually, yes, SRFs will be submitted using the JSON file format. But I'll verify Jose's question, and we can share that with the group as well.
Okay, there's a few more questions in here. Let's see. Going back up. Okay, again, the links to the DHCS Documentation Center, we covered a bit about that. We will be publishing this PowerPoint as well as the presentation. Companion guides will be in that data documentation center, and we can either send it out, as Jeff noted, as a Teams link or as a SharePoint
Yeah,
link, the
that's the
same
links
space.
are just, yeah, the links, there's issues, and I went to the Microsoft site recently, and there's all kinds of questions and pages about that. So we're working on an answer.
Julie Hale has asked, since the 274 is being used instead of NACT and it has a monthly submission, do counties still need to send notice to DHCS of significant changes, as DHCS would already have this information? I guess that is a requirement prior, so she's wondering if that continues as a requirement, and maybe Sherry would know this.
For now, the counties are still going to need to follow the instructions that are in our network certification BHINs regarding
So I would
significant
send
change.
a note, Julie, and let, however you were doing it before, send it to your contact. How do we access the 274 monthly work group? That's a great question. That is actually coming up.
Yes, we will send you an invitation. That's how you
Yeah.
access it.
So we
And it-
will capture everybody here and send invitations out.
Yeah, that is actually a monthly meeting and presentation. So
there's an email to that too, is there not, Jeff? I believe.
I think
Is
we
it
go
the
through the
274
expansion.
expansion email? You
I
just
think we
email
go
that
through
and say,
the
please
expansion.
add me.
We're trying not to have 1 million mailboxes, only several thousand. So
Okay, so the 274 expansion and MCDSS, if we can put that in the chat really quick, May,
Okay.
and that way folks can get their requests to be added to that. We can forward that to the right people for you.
all right.
And you just ask that you want to be involved in that and invited. Let's
Okay.
see.
Ryan Taylor, that is a good question.
Yeah, that's an IT issue.
Yeah, but I'm hesitant to recommend you to the help desk. Let me see.
No. I'm thinking that that's an IT issue within, I really can't tell if Ryan is from DHCS internal or external. But my guess is that you would have to ask your personal IT about that link. And if you cannot get access to it, what we can do is send that information to you. If you send us what you're looking for, get that to you. Okay. And then Amira actually answered a question in chat too. Thanks so much, Amira. All right. I think we captured everybody's questions. If I did not, ping me here. Let's see, just ping me. Can DHCS provide a copy of the EDI standard documents? That's a really great question, because then they can kind of check what they need. Maybe like a picture of what's in the available, the table of contents of the SharePoint site. Jeff, that would be really good.
Yeah, I'll follow up with Greg, because it's kind of a multi-level question. It depends on whether you're looking for the implementation guide or the companion guide. If you're looking for the implementation guide, that's X12. Excuse me. That is okay. Why don't I follow up with you via email? But it's essentially, you have to contact X12 and request the implementation guide from them. So I'll send you more information via email. If there's anyone else that has questions about the implementation guide, which is the master guide, how to obtain that, please put a message in chat, and I'll add you into the email that I share with Gregory.
Okay, and Amira did clarify that all of the 274 file changes, including significant changes, will be pulled from the 274. So Claire was just following up that Amira had posted something different than what I had said and what Sherry had confirmed. And that's because it's very new. 274 getting into play and being utilized is new. It's newer. And so folks are not always positive, but Amira knows. So I'll go with what Amira said. Let's see.
Well, it is going to differ for the DMC-ODS. I just want to point that out because we are not
Okay.
on the 274 platform for DMC-ODS.
Okay. All right, let's just go with the county liaisons and communications slide. Let's just start working through that. And then if we have more questions, we'll hit the end. DHCS liaisons are currently not assigned to the counties for the 274 submissions. So DHCS hosts a monthly 274 work group. This is what we were just talking about in chat. It's held on the fourth Monday of each month. You can send questions regarding the behavioral health 274 expansion in the county work group participation to the 274 expansion mailbox. Just you can note that you want to be included in that 274 work group on the fourth Monday of each month. I don't think there's a listserv or anything like that. You would just be invited. Next slide, please. So MHPs are limited to 4 plan contacts, and you're going to need to identify them. Primary technical contact, your primary compliance contact. Please do not include a contact that plans would not want to have spreading information to other folks outside of the 4 and the necessary people. So you want to keep you know, a good line of contact and a good line of communication available, but make sure that these folks have specific permissions. MHPs should assign a liaison on your end, and that liaison should distribute all of that information as needed internally. That's really useful. Okay, next slide. We have a list of data group mailboxes. These mailboxes will be live once we post this PowerPoint. It will be posted on our webinar page, which we have linked several times in the chat for your availability and use. You can peruse at your leisure. And a lot of the different presentations have already gone forward. You can look at topics that you want, but you can also see that we're going to list communication and live links at the end of every PowerPoint. So the 274 medical, the physical health side is MCQMD provider data at dhcs.ca.gov. The behavioral health plans will go to for the 274 expansion. It'll be the 274 expansion at dhcs.ca.gov. Dental is DMC deliverables at dhcs.ca.gov. Any encounter questions can go to MMCDE for encounter data at dhcs.ca.gov. Behavioral health short DOIL questions go to MEDCCC at dhcs.ca.gov. And again, that DHCS documentation center for access request, go to data exchange at dhcs.ca.gov and put in there that you want documentation center access. Technical questions should go to ECM. Technical questions for ECMCS, CCM, and JSON files go to the EDM data support team at dhcs.ca.gov. And if you have any questions, or this is a lot, you can contact us, tell us what you need, and we will locate those for you. You can contact our team. This is a webinar support team, mcdss at dhcs.ca.gov. Jeff was saying, you know, we have a lot of mailboxes. These are all resource mailboxes that multiple people have access to, so somebody will see your email. If you send it to the resource email box and you mark it urgent and you put brackets around it, that pops up for folks and we find it and we get it where it needs to be as soon as possible. Our resources are available on our quality measures and reporting page. And that's where we started looking at where to put all of this information. So the quality webinar series is posted here. It has some basic information like where to go, but we also, on the next slide, started posting all of our information for the webinars and for all the postings. So that resource page here is the actual webinar series webpage. We are committed to making sure this is a robust page with lots of resource information for every DHCS submitter, county, plan, provider, anybody who's submitting data. We want you to have information as transparently as possible. And this will have a glossary of terms. This will have PowerPoints that we have already posted and submitted. They have the PowerPoints that you can follow with live links, so you don't have to type, you can just click. All of the web pages have specific information. We can go toggling back and forth. We will send you directly to the behavioral health pages that you need in the PowerPoints, and you can get a lot of information from this. You can also peruse all of the different topics, see what was done last year for the 274 mental health, and then the information that was this time should be updated and more informative and not repetitive. We've been following a lot of what folks have been asking us to do, right? They want less repetitive, more informative. We got the message, so we're moving forward with topics and subtopics that are necessary for you so that you're able to do better submissions, better quality data submissions, be valid, have information, to you as soon as possible, and make sure that our teams at DHCS are aware of any issues that you're having. Next slide, please. Okay, so right now, and we have confirmed, the Medi-Cal managed care plans are in production. The county mental health plans for 274 provider network data, they're in production. The county drug Medi-Cal organized delivery systems, the 274, is 75% of DMC-ODS plans are in production. Dental is in production. Behavioral health short DOIL in production. Encounter data in production. Excel data templates, yes, we still have those. They are in production. And the MCP, PCPA JSON files are in production. We are gathering them. We are getting them. We are using them to be able to report data to CMS, to report data back to plans, to help program monitor plans. We are doing everything we can to make sure that everything that is coming in for provider networks and for information for all of the different programs that we support with our data gets back to you and gives you as much information as you can have. As much as we can give you, we will give it to you. Next slide, please. Questions. We're getting questions over here in the chat. Kimberly, not sure I understand. Oh, let me go back up. That was Jeff responding. Let's see. Okay, I'm actually not seeing too many questions.
Okay, so, but actually, I do want to, okay, so Kimberly's gonna send an email. Yeah, go ahead and send that, Kimberly. And why don't you just go ahead and send it to Data Exchange at dhcs.ca.gov, if that's
Put
not a
that
problem.
in the. I'll put that in the.
Great, thanks, Kimberly. Yep,
Any other
thank you.
questions from
Appreciate
folks? Lisa Schwette has a question. Can we unmute Lisa?
Hi, it's Shuti, and I don't have
sorry.
a question. It's okay. I just want to clarify something. Could you go back to the last slide, 2026? Thank you. So there was a question asked earlier about the PDSRF and JSON files and SRFs. So I want to make something clear. The Medi-Cal Managed Care Plans 274 provider network data in production, that is where we receive the SRF in JSON format. the PDSRF, EDSRF, all those forms were consolidated into the SRF. For county mental health plans 274, that is where plans, my understanding, are still submitting PDSRFs. Those are not in JSON format. So they're different files, different things are being submitted at this time. I hope that makes it clear. So SRFs in JSON formats are being submitted for the 274 MCPs. For the county mental health plans, that is not the case. So that is where I think some confusion is happening. Those are still in the flat files.
I think
That's
we'll
all.
need an extra slide maybe to have some clarification related to data collection status so that we can capture some of that information. And Lisa, shoot, we're going to contact you about the FAQs as well. And then we'll make sure that that information is there. We had a question about time frame for county MHPs to start submitting in JSON. Is there anybody who can answer that? Okay, we'll get back to you, Prem, and that way we'll be able to answer you specifically.
Yeah, I'm sorry I couldn't speak up. Yeah, we don't have a time frame on that. We will keep you posted on the JSON development. Also, there was a question about finding the short Doyle companion guides in the DHCS folders. That came up quite a while ago. I could share the path to BHIS. It's essentially
It's a web page.
something that you would either access through logging on to eTransfer and then accessing BHIS folders, or going in through the DHCS application portal and clicking on the SDMC icon. The path is as I just posted, and I'm thinking I will consult with my behavioral health colleagues. Perhaps we can start posting those companion guides on the documentation center as well. So they'll be in 2 locations. That's our only hesitation, keeping things straight. But that might make it a little more convenient for everybody. So I'll look into that. In the meantime, that's the path. Let me know if you can access it.
There is an existing short Doyle presentation if you want to go pop over there and download that presentation and see if it has what you need. But that might answer that question as well and get you all of the links that you need. Any other questions? Well, I'm going to go ahead and adjourn a little bit early, give you all some time back. And if you have any further questions, do continue to send it to mcdss.ca.gov. We will get it to the speakers here today, get your questions answered. We collect that information from the chat, so we will be able to put it in FAQ. Again, this whole presentation was recorded, even with my jumping off and coming back on. And all of the PowerPoint slides will be posted alongside that presentation.